What is a rotator cuff tear? A rotator cuff tear is an injury to one or more rotator cuff tendons. It is common among the elderly, athletes, and people whose occupation requires repetitive overhead arm motion. What is a rotator cuff? The rotator cuff is a group of muscles that moves our arms at the shoulder joint, particularly abduction, internal rotation, and external rotation. It also stabilizes the joint by holding the humerus towards the glenoid fossa. It is composed of 4 muscles: the supraspinatus, infraspinatus, teres minor, and the subscapularis. The supraspinatus is the common victim of rotator cuff tear. Actually, it is the most commonly injured muscle of the shoulder joint, being a victim of impingement or tendinitis. Its job is to help the deltoids during shoulder abduction or elevation of the arms at the side of your body. Tearing happens when the muscle can no longer withstand the tension being imposed on it. The pulling apart of the muscle or tendon can happen suddenly or through a slow accumulation of smaller tears. Causes of the tear are repetitive shoulder movements, forceful lifting or effort, or trauma. The 2 types of rotator cuff tear are partial, where there is only a small wearing or disruption of the fibers, and full thickness, where there is a significant detachment of the muscle fiber or tendon. Common signs and symptoms of rotator cuff tear include pain at rest and during nighttime. This is more evident when you are lying down on the injured side. You might have pain when you are lifting or when you are lowering your arm. There might also be a noted decrease in strength on the affected arm. Lastly, you might feel some crackling sensation when you move your arm at certain positions. Primarily, treatment is done to alleviate pain through medications and physical agents. Physical therapy is done to improve or maintain function. Physical therapists teach and help you perform exercises that would improve muscle strength and joint mobility. In some cases, surgery is required depending on the severity and the impact of the injury on the patient's activities. Still, prevention is better than cure. To avoid rotator cuff tears, it is best to do a warm-up first and perform exercises that activate the rotator cuff muscles before proceeding with high-intensity activities. Make sure you gradually progress your workouts to avoid too much stress and overtraining your muscles. Maintaining flexibility is also a key to a healthy rotator cuff. Stretch regularly, especially at the end of your workout. If you are currently experiencing symptoms of a rotator cuff tear, it is best to consult your physician for proper management. If you want more info, visit www.gomove.fit.